Hi, welcome everyone to this short presentation on role of faith leaders in COVID-19, the work which was undertaken with Rohingya refugees in Cox's Bazar, Bangladesh. My name is Sneha Krishnan and I'm the director of ETCH Consultancy Services. I would like to thank our partners and people who have worked alongside on this project. Before I begin, I like to remind ourselves some of the basic ideas that we've come to in this presentation. We want to say that religious leaders or faith-based actors like majis, imams, and muezzins are often instrumental in spreading awareness on COVID-19 preventive strategies in mass displacement settings like Cox's Bazar. We've found them to be actively advocating these preventive messages amongst the communities and often interweaving them with religious messages. But there continue to be several physical, social, and digital barriers, as well as limitations of the health systems in providing essential services to the Rohingya communities. A little bit of background for the research. This was undertaken earlier in 2021 to understand what role faith based leaders can play to understand and explain different misbeliefs and misinformation which is held by community members. For example, there was a belief that COVID-19 was a punishment from Allah and was a test of their faith and resolution. This program was actually undertaken to work with these leaders and explore their attitudes and beliefs about COVID 19 and also identify what potentials exist to influence the wider community through different mechanisms such as meetings, megaphones, house visits. So, the research question that we try to address in this presentation talks about how effective are faith leaders in changing behaviors to mitigate the effects of COVID 19 within the Rohingya refugee community in Cox's Bazar. The research methods that we adopted here included a mixed methods approach using both qualitative and quantitative methods in an exploratory manner. We consulted both refugee and host communities from camps 14 and 19 for this research and undertook desk review, household surveys, key informant interviews, and focus group discussions. Some of the results are captured here in this table, which indicates information collected through household surveys using Kobo Collect in both host and refugee communities. What do we find that Rohingya community members are telling us? A woman leader talked about spreading information about Corona and Islamic knowledge both while she consulted her neighbors. Whereas there were beliefs that people who did not follow these guidelines were were the ones who were affected by Corona. There were also discussions around constraints about how they could keep distance from each other because they live in such constrained settlements. Whereas an imam talked about the main reason for the spread of corona being Allah, who actually gives two sides to each coin. Some people are good, some people are bad. Similarly, some people who follow these guidelines are able to protect themselves, whereas those who do not follow end up dying because of corona and then perhaps become a martyr, and that's how they overcome their fear. So one of the key findings that we found was that role of faith leaders is quite crucial in this COVID-19 response because they were giving out messages on social distancing, on different facilities that are available for testing within the camps, discussing importance of hand washing with soap and wearing mask in public spaces. They also advocated for understanding of the religious connotations of some of these messages. For example, in a focus group discussion, one of the respondents said that every Friday there are discussions on how we can be safe from corona. The imam gives us the message to be neat and clean before entering the mosque and often tells us to wear a mask when we leave our houses. We came across several reasons what people believed was leading to corona. Some of them included religious reasons or women not being able to follow parda or not doing their regular prayers. People also believed that Allah has incurred this upon people to test their faith or because they were not following the religious guidelines. But in qualitative research, we also found some of them held a lot of misinformation and misbeliefs about how corona spreads. Some popular rumors included that COVID-19 is actually an insect, or it's produced in garbage and spreads because people are not clean and unhygienic surroundings. Um, and the main idea that people wanted to adhere to was this idea of cleanliness. So one of the respondents talked about not being clean and dirty was one of the reasons why corona spread. And they reasoned that elderly were often getting affected more because they are considered to be not that hygienic. Um, Moving on, some of the ideas that we wanted to discuss here talks about the different barriers, enablers, opportunities, and threats that we found in this project. We see that there are a lot of physical barriers that deterred people from adopting these preventive strategies. These included lack of space, lack of materials such as masks or soap. There were also social barriers related to lack of education, restrictions on women, and also access to timely and relevant information. The Rohingyas also have a limited usage and access to mobile phones or digital devices, especially in these regions, the internet connectivity is often poor. There's also aspects of digital illiteracy, health illiteracy, and lack of trust with the health institutions, where people are not happy with the attitude of the staff, the health service providers in these health centers. And lastly, people have started believing various rumors that um, going to the health center means that they will be abducted if they are found to be COVID positive. One another feature that we found was a lot of people resort to traditional healing practices without actually having adequate information, and this often tends to color some of their practices as well. In terms of enablers, what we found was faith-based leaders actually proved to be a useful link between science and faith by connecting messages from Quran about cleanliness with the COVID preventive strategies. Madrasa teachers we found were actually quite well aware of these scientific advances and the day-to-day changes that was happening in how COVID is spreading. They were up to date with most of the information. We also found that women leaders were quite active in supporting Rohingya women and inspiring children to adopt some of these practices as well. What we found that there was a value of repetitive messages which could be provided not just through megaphones and committee members, but also through follow-up visits and discussions with community members. Some of the threats that we recognized was people believe that being neat and clean will actually protect them. Some respondents were not even interested in taking the vaccine, believing that Allah will save them. And even though there is an acceptance of taking vaccine, people actually do not believe that vaccines are good for them. There is restriction on mobile phone usages, and therefore people have limited opportunities to know where they can go for vaccines. But besides these, there are other kinds of risk related to flooding, related to winters, which actually adds and impacts on the population health. There is persistent lack of services related to water, sanitation, and healthcare, which has been prevalent conditions for these communities in mass displacement context. And loss of livelihoods due to the COVID restriction measures have also resulted in increased intimate partner violence. Um, so some of the opportunities that we found was uh, in this space was to widen the definition and relation of faith-based leaders as influential figures in the community. Supporting faith-based leaders as well as refugee communities access to timely and reliable information sources was fundamental to make this change happen. Faith committee members could be more wider by including a representation of women, elderly, and disabled groups in these committees, because they have a potential role to play in reforming community attitudes towards vaccine in these coming months. Focused engagement with these groups would actually help strengthen attitudes towards corona and other health messages which has been given out from the health centers, thereby extending health services to a wider community network. We also found self-reported adoption of hand washing with soap for 20 seconds in the sample that we collected. And we find there is a lot of reliance on traditional health practices, which needs further research and understanding. Thus, to summarize, we feel that there is a potential to widen the scope of who a faith-based leader is and what role they can play in linking faith, wash, and health-related activities in the communities. Through intensive training and financial support, there is a possibility to empower them to build their capacities, enable them to solve problems, and build consensus with the diverse groups that live in these contexts. We also found a potential for relying on oral communication methods rather than audio-visual methods, which will help in reinforcing and aiding recall of these practices within the communities. And lastly, we believe that involving Rohingya volunteers, women, and youth could also lead to a more inclusive approach that will enable change in behavior related to COVID-19. And thus, lastly, I would like to remind the conclusion, which is what I began with, that religious leaders and faith-based actors like majis, imams, muezzins, and others do have an instrumental role in spreading awareness on COVID-19 preventive strategies in mass displacement settings. But there continue to be physical, social, and digital barriers, as well as distrust and limitations of the health system in providing essential services to Rohingya communities. Thank you very much.
Very good.